All right, thank you so much for staying with the Monday Report Town Hall session. Your questions begin now. This is your opportunity. Dr. Patrick Amoth is here, Acting Director General, Ministry of Health, and also the President, WHO Executive Board. Thank you so much for making time, Dr.
Thanks for having me.
Quick question. Let's have a brief situational background. What is your assessment of the fight against COVID-19 this far? Are we winning this war or are we failing in certain aspects?
Thanks, Trevor. The pandemic continues to evolve and we have made significant progress. Worldwide over, you know, most countries are in the fourth wave of the pandemic. And usually the trajectory that follows a particular wave works out the same way global over. So in the past 2-3 weeks, we have also recorded increased number of cases, increased number of people admitted into various health facilities, increased number of people in critical care, and increased oxygen demand. And therefore, we are in a space of increasing number of cases, a true reflection of a fourth wave that is in the offing. But we believe that the measures that were put in place will be able to serve us well. It has been a tough journey, but I think as a country we have made significant progress. I know we have lost lives, regrettably, but also we have saved very many lives because of the interventions we put in place all through. Yeah,
you're saying a fourth wave is in the offing. Are we facing a fourth wave now?
Worldwide over, we are in the fourth wave of the pandemic, and we are not left behind. If you look at the epidemiological curves worldwide, and also the one in Kenya, clearly the cases are rising in tandem with what we saw in the third wave, and therefore the fourth wave is actually in the offing.
Okay. Are you though concerned that we haven't even been able to fully vaccinate 1 million people in a country of 47 million?
Concerned, yes, but not alarmed, because one of the challenges we have had is global supply constraints in terms of supply of the vaccines. And therefore, the little vaccines that we have received, we have put into effective and efficient use. And had we had more vaccines, I believe we would have done much better. But despite that, whatever we have had, we have put into good use. And I think we are making remarkable milestones in terms of our national vaccination deployment plan. And if more vaccines continue to come into space, like what is happening in the past 2 weeks, remember we have received more than 1.2 million doses in a span of just about a week. In the sub-Saharan Africa, East and Southern Africa alone has received just 29 million doses of the vaccine. So that, for us, that 1.2 coming in a space of 1 week is significant. And Kenyans can be assured that this will be quickly put into use so that we enhance and secure the protection of the Kenyan population. We believe that a vaccination program through the KP, Kenya Expanded Program on Immunization, is robust enough, working with the counties and the private sector, to be able to deliver vaccination to everybody, everywhere, once the vaccines become available.
But from the current pace, it's almost obvious that we will not hit the 10 million mark by December. What does this then mean for Kenya?
It looks like that we may not be able to reach that. But remember that when we started at about a figure of 1,000 vaccinations a day. We incrementally increased that figure over a period of time to last week when we were hitting 40,000 per day. And significantly on Friday, we hit a target of 70,000 vaccines per day. So if you look at a period of 1 year, our target for September is about 150,000 vaccinations a day. If you divide that by 10 million, that comes to about 66, 67 days. So it's still achievable, so long as the vaccines are available. So we must be pragmatic enough that if the vaccines are available, this is a figure that we can be able to achieve within that timeline. And of course, also ensure that we administer the vaccines to the 27 to 30 million adult population within 1 year, if we maintain that trajectory of 150,000 doses per day.
You clearly said at the airport that we should not mistake vaccine hesitancy and lack of vaccines. What is the plan to ramp up vaccination? Because there are still some people who are a bit hesitant.
On the contrary, many Kenyans are willing to take the vaccine. And you saw even when recently Nairobi Metropolitan Services tried to do an outreach, and the number of people who turned out was quite overwhelming. A similar scenario obtained in Nyeri, where a church and some community people decided to do an outreach targeting 200, and within a span of 2-3 hours, more than 500 people turned up. So I believe the demand for the vaccine is there.
Yeah.
But the approach we are going to use is a multi-pronged approach to be able to deliver the vaccines. We'll use the fixed post-vaccination situations. We'll also do outreaches based on micro plans done by the counties, that is mapping of specific populations and how they are going to deploy the outreach programs. And of course, we'll also do the mass vaccination campaign.
Yeah.
Underpinning this as the major plank, of course, is risk communication and community engagement to be able to ensure that we create a demand.
Yeah.
And this we'll be able to do in partnership, including with you people in the media, community resource persons, religious leaders, and everybody, so that in this journey, together we do it as a whole nation and a whole people.
Yeah. DG, there's been talk online of lift the curfew, open the country. How many people have to be vaccinated for the country to actually be fully reopened? Oh,
Trevor, you're referring to herd immunity indirectly, where this herd immunity is basically defined as a population protection because of the number of people who have either been vaccinated or have prior exposure to the infection. For coronavirus disease, emerging evidence shows that you need to, 7 out of 10 people need to be protected for us to be able to reach that figure. But this threshold is not one size fits it all. It will vary based on the dynamics of the virus, including evolutionary changes of the virus, like the mutations, and also the measures that we put in place. If we do that and then we still have gatherings, we don't adhere to the public health social measures, then even with that, you may not be able to achieve the herd immunity. But in a nutshell, it requires 7 out of 10 people to be protected for you to achieve herd immunity for coronavirus disease. Yeah. On a quick math on that, if we 47 million, that's about 70%, 0.7 times that 47 million, that's about 32 million, yes. 32.9 million. Yeah. At what point will we get this number vaccinated? This number, we hope, if the vaccines become available by the end of next year, we shall be able to achieve that number. So by the end of the next year, we should be okay? Yes. Okay. So we know, do we know how long that vaccine lasts in the body? Oh, this is still a very fluid situation, Trevor. Information is emerging day in, day out. Latest information from America, and which America has used mainly Moderna and Pfizer vaccines, shows that after a period of 8 months, then the antibodies produced after vaccination begin to wane. And you have seen that communication from CDC in America saying that we'll need a booster shot after 8 months. Yeah. However, because in Kenya we have mainly used the AstraZeneca vaccine, we'll need to wait for our data to be able to tell us the level of the antibody and when it begins to dip and when it may require the booster dose. Yeah, but we've now just gotten more than 880,000 doses of Moderna now. Doesn't that complicate your life even more because you don't have enough data on AstraZeneca just yet? The data for AstraZeneca is being generated because as of today, we have vaccinated more than 1.6 million of the first dose of AstraZeneca, and more than 780,000 people are fully vaccinated. That's about 2.9% of the Kenya population. Yeah. For the doses of Moderna that we are receiving, these are insignificant doses if you look at the entire population. So our data will mainly be driven by the people who have received the AstraZeneca vaccine. Yeah. Are we leaning more towards AstraZeneca, or are we now open to get any sorts of vaccines that come? We are open to get any sorts of vaccines that that come into our space. And next month, we are going to receive Pfizer vaccine. And also next month, we are in the pipeline is Johnson & Johnson, the single-shot vaccine. We are going to receive 393,000 doses. And we are also going to receive Sinopharm vaccine from China, end of September. So more vaccines will come into our platform. And remember, in terms of efficacy, all the vaccines protect you from getting severe infection and risk of mortality. Yeah. So it does not matter which vaccine you get. But do we know the kinds, if there are any side effects? Do we know what adverse sort of side effects have been there? We have reasonable data now based on, if we remember, we started our vaccination deployment plan in March. Now we are in August. We have data of about 5 months, or more than 1.6 million people. Majority of the people we have, in terms of our pharmacovigilance data, we report what we call adverse effects following immunization, or AEFI. We have received reports of 615 reports. Out of these, 11 are still undergoing active surveillance, meaning we are still following them up. But most of the side effects are minor things, including pain at the injection site, you get headache, you get pains in the joints or arthralgia, you get myalgia or pain in the muscles, you get fatigue or general tiredness, you get nausea, some people feel like puking. A few ladies have reported excessive menstrual flow called menorrhagia. But generally, most of the side effects that we have reported are mild and have not required any hospitalization. Okay. And I want to inform you that we have not recorded any death out of administration of our AstraZeneca vaccine. Neither have we reported any clotting disorders.
Okay. Now that we're talking about statistics and deaths, there seems to be more deaths recently. Like yesterday, 32 people were reported dead, all being late deaths. Do we have the true picture of the deaths? And what does late deaths even mean when you send to the media houses and say late deaths?
Trevor, in line with the International Health Regulations 2005, in terms of a pandemic like this, we are obligated as a state party, members of the World Health Organization, to report. And therefore, wherever the deaths occur, whether they are late or whether they're reported instantaneously, we are bound to report them. Of course, when there's a surge in number of cases, people will die, of course, because this is a disease for which we don't have any specific treatment. Most of the treatment is supportive. Yeah. And especially if people at community level are not able to reach health facilities in good time, there are chances that outcomes will be bad. Most of the deaths actually occur in facility, and we are working together very, very closely with the Ministry of Interior through the civil registration of vital statistics to be able to marry our numbers in terms of the deaths that occur at community level vis-a-vis the deaths that occur at facility level. Yeah. But important, Trevor, is to tell you that out of the 30 deaths that I reported yesterday, or 31, and today 30, 90% of those deaths have occurred in people who are more than 50 years old. Okay. So if you are more than 50 years old, we have enough quantities of vaccines. Please go out and get your vaccine. Yeah.
Have some of them passed on despite having been vaccinated?
I don't have that figure as of now. Yeah. But I can give you, again, statistics. I like numbers because numbers speak a lot more than the words we speak. Yeah. We looked at the data in one of the mid-level hospitals in Nairobi for the past 3 weeks. Out of 108 people who are admitted, yeah, in critical care, HDU, and the general ward, out of 108, 99 are people who have not received a single shot of vaccine. 8 of them are people who have received one single shot of vaccine. And you know, with one single shot of vaccine, the protection is a little bit reduced. Yeah. And only 2 people who have received a double dose of the vaccine or the full vaccination have been admitted. Yeah. So that tells you the degree of protection offered by vaccination.
Okay. So why is the government forcing civil servants to get the jab, DG?
Governments will make policies on a day-to-day basis based on evolving situations. Civil service is critical for service delivery of services, wholesome government delivery of services. And of course, because the vaccines have become available, it has been found necessary that civil servants be prioritized for vaccination so that the government business continues. Yeah. You can imagine a situation where now healthcare workers decide not to take the vaccines and people are falling ill. Who is going to take care of those people who are in hospital who require service? Yeah. Suppose our police or security officers decide that they're not willing to take the vaccine, yet it's available. Will we be able to tolerate the lawlessness that will come as a result of that? No. As a responsible government, we have to make these policies. And I want to tell you, one of your colleagues from CNN, 1 or 2 of your colleagues have been fired. And very soon the private sector will take you. And it will be probably mandatory for you to be able to be fully vaccinated, to be able to enter certain places, to be able to offer certain services. Australia, their main airline, Qantas, the other day said, if you're not fully vaccinated, you choose whether to come and work with us or stay at home. But of importance is that because the vaccines are available, it is our civic and patriotic duty to be able to take vaccines, not only to protect ourselves, but to protect our loved ones and the entire community and the entire global village.
Okay. Sam Rere here on Twitter is saying, kindly ask for those who have recovered from COVID-19, how long should they wait before taking the vaccine? Some say 2 weeks, others say 3 months.
On average, we tell you 3 to 6 months waiting period before you get the vaccine.
So after you've recovered, you wait 3 to 6 months waiting period.
Yeah, because natural infection also induces antibody and cell-mediated response that ensures that you are protected over that period of time. Unless a new variant emerges, it's unlikely that you'll get another infection.
Yeah.
Or even if you are to get it, it's likely to be a very mild form of the infection.
This is whether you have the first or the second. Because there are those who get infected after having the second, and there are those who get infected after having the first. You still have to... After the second,
because that is you are assured of a degree of full protection, then you tend to get a milder one. After the first injection, you see the degree of protection is a little bit lower.
Okay.
Yeah.
Samuel Orutua says, can Dr. Moth clarify whether we need to take a new vaccine every time COVID-19 evolves or mutates, because it's a new fashion of virus which has dodged many forms of antibodies?
Emerging evidence shows that most of the vaccines that are approved and pre-qualified WHO are equally effective against emerging variants, including now the Delta variant, that is predominantly the circulating variant globally and driving the fourth phase of the pandemic in the global community.
Yeah.
So most of the vaccines will work against the variants. And of course now, because scientists have had time to be able to learn about the virus, very many of these vaccine manufacturing plants will just simply be able to tweak the vaccines a bit to be able to deal with any emerging variants.
Yeah. Vincent here says, follow-up question on the warning antibodies. Is there any ongoing study in Kenya on inoculated people to track the antibody decline? If so, what are the details subject to the tracking? Or will we be having to get this jab every year, like the flu shot?
Very good question from that gentleman. That study is ongoing at KAVI, Kenya AIDS Vaccine Institute at the University of Nairobi. I've personally been to that lab, a wonderful place, and the scientists are doing beautiful work. I saw the graphs, and very soon they'll be able to share that data with us to be able to inform policy decision going forward.
All right, stay with us. I need to take a quick break. When we come back, there's still some questions coming through on Twitter and also some video questions that are sent through to you. Keep them coming. Use the hashtag Monday Report at Trevor Mbija at Citizen TV Kenya. We are back in just a bit.